Hey guys, William here with fitnessforbackpain.com. I want to go over some mobility and kind of mashing techniques for the QL. We're talking about stretching the QL, finding out if it's tight or not, finding out if it's potentially a major cause for your back pain. Number one thing to do, obviously, is to get checked before you start pushing around and mashing things out and it's assuming things are tight and it's causing your back pain. This is a very high potential that your tight QL could be causing your back pain. If you read through the article that actually goes with this video, it really talks about in detail what to look for when you talk about with a tight QL and how to stretch it and what ways to go about really finding out whether the QL is actually your issue. Okay, so find that out first. Make sure you have a good diagnosis. Once you're good and you have a very good idea that you are actually suffering from a tight QL, this video is going to be talking about using a lacrosse ball. I have a lacrosse ball. You can use a tennis ball. It's a little bit too soft, but if you have a very tightly wound, very inflamed QL, going straight to the lacrosse ball might be a little bit too intense for you. Okay, so where your QL is at, basically what it's doing, it's attaching to the top of your hip bone and your lower rib. Okay, so if you were to take your hands and basically between your belly on this side and the middle of your back here, right where that this side of your spine is actually, if you go right in between there, that's kind of basically where that QL is at. If you were to take your fingers, stab it, and fold over, there's like a little piece of space there between your rib and your hip. That's kind of where you're playing with. It's not big. It's probably about that much of room where that QL is kind of stretching out over and connecting to the lower part of your spine. So when it comes to trying to mash this out, you always want to focus on this part of your recovery before you go into the stretching. You always want to manipulate the muscle, try to get it broken up, try to get it warmed up before you start tugging on it and try and do different stretches, okay? So what you're going to do, basically, if I were to show you from behind, obviously this is your spine here. You got your right, or my right, and my left here, and that QL is going to be right about in here, okay? So when you're going after it on the floor, you almost want to think about like you're attacking it from the side. You don't want to lay it here and just go straight back with it because you're not going to be on the QL. It's a very deep seated muscle. It's not right on top. You've got a lot of other layers. I think like 2 other major layers of muscles that go over the QL that's kind of hidden. So you have to go pretty deep. So what you're going to do, now that you kind of know where it's at, if you have to stand up, kind of feel around for it, find out where that lower rib is, and then find out where your hip bone is, and kind of find that spot in between. You can sit back nice and slow. See if I can pull my shirt tight enough so you can see this. And again, you're going in it from the side, so you want to try to almost put it down and then slide into it. And you should feel it. If it's a nice, tightly wound QL, you're going to feel it, okay? So I'm here. I have it kind of where I think that QL is, and I'm trying to find some trigger points. I'm trying to find some spots, like right there, that's kind of causing some issues. So once I get that issue, once I find that tight spot, what I can do is you can do the whole contract, relax, where you squeeze everything super tight, and then you relax it and let that ball go a little bit deeper, okay? So you can go up, you can go down, but again, once you hit that lower rib, you'll know you don't have to go any higher than that. Once you hit that top of that hip bone, you don't have to go any lower because that's basically as far as it's going to go down, okay? So do that, work on that a little bit. Thanks for watching, guys. Subscribe to the website, and I'll see you later.